I'm going to check the doctor's order or verify the indications via protocol for drawing an arterial blood gas for this patient, Mr. Jones. I'm going to look in the chart to see if there's any contraindications for drawing it. Maybe he got a dose of urokinase or streptokinase, or maybe the platelets are low, or maybe there's a factor disorder or some reason why we need to be more cautious. Maybe the patient's on heparin or warfarin. So I'm going to check the chart to find out all of that information. Then I'm going to sanitize my hands, put on gloves. The equipment I brought with me is 2 arterial blood gas kits and a towel. I'm going to introduce myself to Mr. Jones and explain to Mr. Jones that I'm going to be drawing some arterial blood, and that is going to give us an exact oxygen number, and it's going to also give us information on how the carbon dioxide level is in the blood and the pH. I'm going to identify and make sure this is Mr. Jones by asking him his name and verifying that on his armband and his date of birth. I'm going to assess the site to see if the site is acceptable to use. I'm going to check for any purpuras or any fistulas in the arm. I don't see anything there. I'm going to do a Allen's test. I'm going to ask the patient to make a fist. I'm going to push on the radial and ulnar artery really hard, hard enough to stop the blood going to the hand. Then I'm going to have the patient release their hand, and I'm going to release the ulnar to make sure that there's a palmar blush within 5 to 10 seconds. If that's the case, then we can use the site, and this site looks good. I'm going to prepare the arm by placing the towel underneath the wrist to allow it to bend down ever so slightly to bring the artery to the surface. I'm going to get my needle ready. I'm going to prepare the site with alcohol. I'm going to start in the middle and work my way out in circular motion. I'm going to allow that to dry for at least 15 seconds to make sure that all the microbes have been killed. I'm going to make sure that my gauze is close by. Make sure that my needle is on tight. My bevel is at a 45-degree angle. And I'm going to feel for the pulse. I'm going to insert the needle. The blood is pumping up. I'm going to pull the needle out. I'm going to secure the needle. I'm going to make sure that there's no air bubbles in it. Pushing out the air bubbles. I'm going to get my tag ready with the patient's FiO2 respiratory rate or ventilator settings if he's on a ventilator. get that marked correctly, put that in the biohazard bag. I'm going to make sure that my setting has been restored. I put the needle in the biohazard container. I'm going to thank the patient and leave the room.